I'm really glad to introduce Dr. Shaista Anwer. Dr. Shaista is currently an Obs and Gyne trainee. She's about to become an Obs and Gyne registrar, which I know that she's looking forward to. So without further ado, because I know lots of you have been looking forward to this talk, I'll let Dr. Shaista continue. So thank you, Shaista. I'll hand it over to you.
Hi, my name is Shaista. I'm one of the ST in Obs and Gyne training. I'll briefly discuss about Obs and Gyne pathway. There are lots of things to cover, so I'll try to touch everything what I can today, but I'm more than happy to answer any questions on my Insta, on my chat, anytime, all right? So let's begin. The topics which we're gonna cover today are basically about, I'll discuss some facts about Obs and Gyne. How does it feel like working in Obs and Gyne? Briefly discuss about MSRA process and everything, interviews and some important links, which is very important. I can't emphasize enough. I know people have specific questions about their journey and stuff. These links have all the answers you need. I'll show you some links how to go through them to find your relative answer. So about me, I did my MBBS from Pakistan, did my foundations year in Pakistan, then did my PLAB, GMC registrations, and started my first job as a non-trainee in neurosurgery, like an F1. That's another topic. Why did I choose F1 and things like that, just to settle down in NHS and just to get to know the system and work towards my application for Obs and Gyne. Okay, so this answers the question that, do I have to be in Obs and Gyne jobs if I want to go for Obs and Gyne training? No. You need to work on your competency. You need to work on your application process in any kind of job. And I can't emphasize enough that you need to start from non-training job so you can work on your applications and you can know NHS well before you jump in any training job. Now, I will discuss about what level you want to jump in training in Obs and Gyne just in a minute, okay? My second job was luckily in Obs and Gyne. That gave me a good idea that how Obs and Gyne is, what are the specific area I need to work more, and is it really the field I want to be in the UK? Because sometimes working in the same specialty in your country is a bit different than working in UK. So it can be a bit challenging and overwhelming if you just jump in the training job. For example, back home, if I had dream of like working in cardiology and I'm just going to jump in cardiology without tasting it here, that's going to be a bit of challenge for me. So I would really push people to at least try some specialty as a taster week or as a non-training job before jumping in your specialty pathway. Okay, so I started my training in East Midland in last year, August. So I have completed my 1 year in Obs and Gyne, and I'm very much happy that I have opted for Obs and Gyne, and I worked at least a year or more than a year to work through my applications. Don't rush for it. Don't jump for it. It's gonna cause more harm than good. I know it sounds like silly that I need to work on my applications for a year or so. People just want to jump in once they're in NHS. After a month or two, they want to apply for applications. If you're not well prepared, it's not gonna look good. Right, some facts about Obs and Gyne. People have different opinions that do I need to start from ST1 or ST3? Obs and Gyne is a run-through training program. That's a good thing about it. So once you have been in Obs and Gyne, let's say ST1 level, it's going to be a 7-year training program. And you're going to be in Obs and Gyne throughout that 7 years. You don't have to do another round of applications for ST3 like medicine. So once you're in ST1, you're going to go through 1, 2, 3, 4, 5, and 6, 7. A lot of things to be done throughout these years. Every year you are assessed by your ARCP panel, your exams and all the competencies, but you don't need to fill out another application at ST3 level. Okay, I'm talking about training pathway here. Now, if you want to go for ST3 directly, for ST1 and ST3, there are different person specification criteria. There are certain limitations. I'll go through those person specification in a minute. Okay, so ST1 is less challenging to enter as compared to ST3. If you can see the ratios I have on my second block here, competition ratio, when I applied for ST1, the competition ratio was 3.37. For ST3, it was 14.1. So you can see there is a lot of competition at ST3 level, but the limitations being are for ST1, let's say, you don't need many skills, you don't need many exams. All you need is your commitment to specialty. You should not be doing obs and gynae for more than 24 months, and some other communication skills, teamwork, and etc. For ST3, it's going to be same like when you're in training pathway, they expect you to be doing certain things by your year 2, like any basic C-sections, MRCOG Part 1 exam, some researches, publications, and that will make your application for ST3. And making note of ST3 that you should not be doing more than 60 months of obs and gynae if you want to apply for ST3 training pathway. Okay, I'll show you the specifications on the side so you can go through them separately, step by step. Now let's come to the non-training pathway. There's another pathway for non-training, which is like favorite for people sometimes. You can apply for obs and gynae jobs if you're not willing for training pathway, or you are nowhere between these 60 weeks or nowhere between 24 months and you want to still go for obs and gynae. Non-training is your pathway. It's a bit tricky. You still can find some jobs. You can still find the same pathway as a training pathway. You will find your supervisors, your mentor, who's gonna teach you, help you, but that's a bit tricky because you're not being supervised every year. You need a long run contract with a trust or your hospital, and you need to explore more from your side what is needed by each year. And after you're done with all those competency as a training person, they might give you the certificate of completion of training. Okay. Now, people, when they're coming from our countries, from back home, they usually have more than 10 years, 15 years experiences, sometimes more than 5 years experiences. They've done their own training from there. They may start from non-training job here, then they may jump into ST3. It's not impossible saying that it's 14.1. I just had my 2 colleagues applied, not 3 colleagues actually. They applied to ST3 training, okay, and they got it. They did their trainings from their home countries, like 4 years, 5 years, and then they came to UK and they worked through their applications. It's a bit tough as compared to ST1, but still you can go through that. It's not impossible, okay? Then with the non-training pathway, there is another route with GMC. I'll show you the site where you can go and calculate your journey, okay? For now, MRCOG, these are exams for RCOG, obs and gynae exams, member of Royal College exams. There are 3 exams, 1, 2, and 3. For ST1 training pathway, because I will be particularly talking about ST1 in depth. For ST1 applications, you don't need essentially MRCOG Part 1. In their training timeline, they expect you to be done with Part 1 by your year 2. So when you are done with your ST2 year, they are expected that you would be done with MRCOG Part 1, not 2 and 3, just Part 1. So when you're filling out the applications, if you haven't done Part 1 exams, that's absolutely fine. So like other training pathways, your exam is not essential, okay? It's good if you have done it, it's bonus point, but if you haven't done it, don't kill yourself for that, okay? I'll show you the timeline of applications and stuff. There's a high dropout rate. As I said, if you haven't tasted obs and gynae, if you don't know it's meant for you, I won't rush to jump into a training with such a commitment, okay? As I said, it's not impossible. If you want to go for ST1, you just need to be sharp and smart about it, okay? If you want to go for ST3, you need to be committed towards your specialty. Show them your commitment, show them your interest, show them what you have got for them at ST3 level, and I'm sure you will get it. Working in obs and gynae is like a dynamic day. It's not like you're just going to clinic for a day and you're just going to do the clinics. You're just in one field, it's stuck. No, it's not like that. As you see, it's obs and gynae, okay? And it in itself, it covers a lot of things. In obstetrics, you have prenatal, antenatal, then postnatal, labor, delivery, and there are a lot of areas to cover, okay? In gynae as well, there are so many things in gynae. There are so many specialties in that, okay? So your days are not same in a week. One day you're doing something, other day you're doing different thing. In a day you're doing different things. Sometimes you're doing clinic in the morning, doing theaters in the afternoon. I would say it's a combination of your medicine, your surgical skills, and your psychiatry skills as well. Okay, because it requires a lot of communications with your patients, with your team, because you're not working just with your colleagues. You're working in a very specific field where you have midwives, where you have nurse practitioners, where you have other colleagues, and your patients. Okay, so the communication skills are very, very important in obs and gynae. Okay, a lot of teamwork required with your colleagues. One time you are junior to someone and then you are senior to them as well, so you need to be learning, you need to be dedicating your stuff. Okay, as I said, basic skills. When you're applying for ST1, they're not expecting you will be an obstetrician or gynecologist. Okay, all they want from you is that you have some diverse skills which you can utilize being in obs and gynae, and then they will teach you what is needed from obs and gynae. Okay, so they are not asking that if you're master in obs, master in gynae, only then you can achieve obs and gynae. No, they're asking if you can do certain things which they're expecting after F2 level, F3 level. That's all they need from ST1. Okay, it's a very senior support team. Okay, when you're working as ST1, they're not asking you to make a decision about is this lady gonna deliver. Okay, just an example. Okay, it's a very senior diverse field. You have your senior support, and I really enjoy that. Okay, you have lots of opportunities to learn. So process of application, it's simple like any other specialty. The applications will be open. Okay, usually in November, December time, you will submit your applications via Oriel. It's just simple applications where you fill in your details, employment history and stuff. You will say, for example, if you're applying for ST1, you're gonna say, I haven't worked more than 24 months. You're gonna tick that box up and it's gonna go in long listing process. Okay. Long listing is done by reviewing your application information you put in, and they need your crust form. We know that. That's going to show that you are eligible to apply for training jobs. Now you've done your foundation years and you're ready to move in specialty training. Then they will, if you're long listed, you're going to get the MSRA invite, okay, which is multi-specialty recruitment exam, same like GPs, same like surgeries. You're going to prepare for your exam. You're going to give your exam. You're going to get some scores, okay. Once you get your scores, you pass the exam, 33% of that exam score is counted towards your final scores for obs and gynae. Okay, 33% of that score is counted towards your final scores, and then they will send you some invites for your interviews. Nowadays they are doing some online interviews, so it saves you a lot of hustle. You will prepare for interviews. I'll show you the content of interviews. It's like divided in 3 sections, I can say, or 2 sections in a chunk. One is your portfolio section, second is your clinical section. In your portfolio sections, they're gonna just ask you about how you're committed to specialty, okay, and they're gonna score you accordingly, okay. And then in the other chunk of clinical scenarios, they're gonna give you some clinical scenarios. They're gonna expect you to prioritize your cases according to emergencies, according to needs. What investigations are you going to do? And they're going to judge you clinically on that. They're not going to give you feedback for that. They're going to mark you for that. Okay. At the end of that, your scores are going to be out of 200s, if I'm not wrong. Those scores are going to be your 66%. Okay. These 66% and that 33% from your shortlisting scores are going to count towards your final scores now. Then you're going to give your preferences on Oriel, that which areas you want to go first in terms of your preferences, and then they're going to give you your offers. Okay. Lastly, they gave me, when I applied, I got 366 rank number. I got 366 rank number out of 518 applicants. And mind you, there were slots, I would say, between 150 to 250. Okay. So you can see a lot of people got the rank number, but they might not got the offer, or they got the offer before me. They rejected the offer because they apply for more than one specialty, or they were no longer interested in that area, so they rejected and the offers came down. So it's still not impossible. Okay, these are the links I was talking about. We have our own, I write my own blogs on Med Helpers, where I just discussed about specialty and some clinical experiences and stuff. We have a group of obs and gynae trainee. Okay, that's the second link. The third is my own profile, and the fourth one is my own Insta. So now about these bottom three links, these are very important. Just want to go through these with you. Let me show you the specialty score first. Okay, so this is the site. If you can see here, the link is in your PowerPoint. This is the main site where you have all the information for any specialty. Okay, if you go through the obs and gynae part specifically, they will give you the guideline about MSR exam. They're going to give you the timeline when the next round is opening and when is the closing dates and when they're going to give you MSRA invites and all those timeline things, and the person specification and the vacancy numbers and all those things. So if I just go through the person specification part, this is the ST1 specifications. Okay, it's nothing unusual. They just want you to be MBBS qualified, eligible because you've done your training in F2. Okay, GMC register, fitness to practice, you're skilled in English language. You can see there is nothing rocket science in about person specification. Apart from this rule, it says 24 months or less experience in obs and gynae, and that doesn't include your foundation model. Okay, and then again, you see here, this is your essential and desirable criteria. Your post-graduation degrees, BSc, MSc, PhD, or anything, that's your desirable criteria, not your essential criteria. Okay. Again, in academic skills, teaching, audit, again, if you have them, they're going to give you good scores for that. Of course, if you have teachings, you've done some teachings, you need to have some feedbacks. I usually make Google feedback form, and then I keep them as a record, and I can show them if they need. I have some audit done. As I said, when I did my non-training jobs, I did 2 audits. Okay, that helped me in the application process. Okay, you can do some courses as well, which shows your commitment to specialties. Again, nothing as such rocket science. Okay, nothing really. And if I go on ST3 now, you see here, ST3, that requires some things. See, you need to be MBBS qualified and you need to be done with part 1, not part 3, just part 1. Okay, you should be eligible, as we said, as per the competencies of ST1 and 2. I'll show you what competencies are for ST1 and 2. You should be eligible with the English language course. You should be showing your career progression. Okay, at least 24 months of experience here. Okay, not less than, but at least 24 months of experience. That's like ST1 and ST2 experience. Okay, if you want, you can do these exams, you can do these PhDs, MDs, you can do part 2, part 1, but again, part 1 is essential, part 2 and part 3 is your choice. Okay, again, as many researches, as many audits, as many teachings you do, that's going to help you in your final applications. Okay, so this chunk which I just showed you, this is for your long listing part. Okay, you need to fulfill these criteria to get long listed. Once you're long listed, then comes your interview process. Okay, I'll show you the interview stations, or just a format of interview. Okay, now here is your format of portfolio of interview. What they are asking or expecting from you in interview process is your commitment to specialty. That's really about it. How you can show that, why do you want to pursue a career in obs and gynae? What challenges do you think you're going to face in obs and gynae, and how do you think you're going to overcome that? What do you understand by obs and gynae training? Okay, how can you show you have done something which shows your commitment to specialty? Now, let me give you an example. For example, if you haven't done any jobs in obs and gynae, okay, but you've done some audit, you have done some things which are like maybe indirectly related. Okay, you can show that I did this, and I think this is showing towards commitment to my specialty. Okay, you did part 1 exam, you failed or you passed. Again, it shows that you're committed towards the specialty. You've done the taster week. As I said, any non-training job, any taster week, they're going to show that you're committed to specialty. So you're going to cover this part very good. Okay, training priorities for the 12 months or post, again, they are assessing how much do you understand from the training post. They're going to ask you that, what do you understand by the program? Is it run through? Is it like splitted what is gonna be expected from you in obs and gynae. Okay, quality improvement, as we discussed, if you've done audits, if you've done any research projects, do you understand them? That's going to cause some scores for you. Okay, teaching and research experiences. If you've done any teachings, it doesn't say what kind of teaching, what level of teaching. Of course, the higher you do, the more the scores you get. Okay, but they're going to go give you some scores. So this is all about portfolio section. Okay, sometimes they do ask about the evidences. If you say I have done teachings, they will ask you some feedback forms. If you say I have done QIP, they're going to ask you some certificate or evidence, but maybe they won't. Okay, but work towards these if you're interested in obs and gynae, and that's going to cover your portfolio section. Okay, the second part, which is like your clinical scenarios. As I said, they're going to give you some scenarios for clinical information, and then they're going to ask you, can you prioritize them? Okay, in terms of emergencies, in case of needs, and then at the end they're going to score you. They're going to probably give you one by one, 1, 2, 3 scenarios. Okay, and then they're going to silently score you for that. Okay, the second part of the clinical part of the interview will be where they're going to give you communication skill sections. Okay, they're going to give you again a scenario, any F2 level scenario. They're going to give you examination, they're going to give you some findings, and then they're going to ask you how you're going to deal with the station. Okay, again, they're going to give you feedback silently. At the end of the day, this part, which is your communication stations, this part, which is your mock stations, where you are prioritizing your stations, and your portfolio section, it's all going to add up and 33% of your MSRA score. And then you're going to get a rank number accordingly. I didn't rank too high. I was just 366. I thought it's going to be impossible, but as you see, it's not impossible. I got it in East Midland. I was expecting I will be nowhere near here. Okay. The other thing which I want to show you is the criteria of specialty. Again, as I said, these websites are really, really important if you have any doubts about any questions in obs and gynae. So if you go on RCOG site and you write your matrix for RCOG, okay, they're gonna give you your matrix for each year. Okay, as I said, if you are applying for ST1, of course you're gonna be less competent than ST1, right? So they're not expecting anything more than any F1 or F2 level person can do. Okay, but for example, if you're applying for ST3 level training or non-training, let's say training post, then of course they need you be to competent in ST1 skills. They want you to be competent in ST2 skills, and they will be training you from ST3 onwards. Okay, so here you see by ST2, MRCOG Part 1, your C-sections, your operational deliveries, your perineal repair, your surgical management of miscarriage, your IUS insertion, your endometrial biopsy, and your smears. Of course, your mini CACs, your CBDs, your reflective practice, and everything counts towards that. And they have already mentioned what courses you need to be done. Okay, so if I'm applying for ST3, then I need to be done with all these things by time I'm applying for the application, and I need to show them in my interview, okay, where the portfolio section will come in, that I'm done with these things, so they can score me accordingly. Okay, but for example, if you're applying for ST1 level and you have done with any of these courses, which is like in ST1, for example, you have done with basic practical skills in obs and gynae, you have done some CTG training, you have attended any prompt course, any of these things, not all of these, but any of these things, that's going to show towards your specialty interest. That's going to give you scores where I said that you're committed to specialty. Okay, so everything is in these 3 links which I said. This is where you will get all the information about your scores, about your application round, your MSRA exams, and everything. And then RCOG side is your key to go. Okay, the last thing which I want to show you is this side. If you write that you're looking for CESR pathway, okay, that's the pathway if you're not keen towards training pathway. Okay, if you think you've done your obs and gynae training in your country, you've done many years in obs and gynae, you're not interested in any more training years, and you just want to get a special a certificate which says you're a consultant now, right? So you're going to go through this pathway. But again, every application will be different. Okay, you're gonna go through this site, you're gonna ask, you're gonna follow these steps, you're gonna go to GMC site, you're gonna fill in your application requirement, they're gonna assess your application, and then they're gonna give you answers that what you need to do further or not. Okay, the only one thing which people ask a lot, that if I'm going through this pathway, not through ST1, ST3, do I still need GMC registrations? Okay, they will be happy to assess your application. Okay, they will be giving you answers for that. To assess your application, you don't need the registration, but to get your certificate, you might. Okay, it says your answers here. So if you go through these applications, they will give you all the answer. Okay, again, in this pathway, again, you're gonna be following all the things in the matrix. Okay, if you're asking for CESR pathway, of course, they are expecting you to do all these things on your screen. Okay, all these years with all the evidences. Okay, all the feedbacks, all the exams, and then they will assess your application accordingly. Or if you're not successful, they will tell you where you wanna go next. What is your right pathway now? Okay, so if you want to work through obs and gynae, you need to work smartly, and it's not impossible. It's bit, just go through what you need to do and just start getting on with it. Right. Any questions? I know I rushed through it, but I just want to show you how you need to go through it, and you can work accordingly and read the stuff. I just don't want to read all these things to you. It's all on the sites, and it's all a lot of things in the depth.
Yeah, that was brilliant. Thank you so much, Shaista. Just like I remember last year, it was crisp and to the point and went through all the key points. And I really like the way that you went through things at the end and showed people how to do it, because that and showed where to look and what do the sites look like. And that's really useful, because we could put a whole load of links out to people, but actually showing them is another thing. So yeah, thank you so much. We do have a couple of minutes, so it might be worth going through some questions. Pooja, a few words before we go into a couple of questions.
Yeah, Shaista, really useful. That's coming through in the comments. Loads of people have said that they really appreciate your talk. Lots of questions. Aman, do you want to start off?
Yeah, so we've got one. Can you highlight ST3 responsibilities in brief is one question. Can we do less than full-time in gynecology and ONG? Is that an option?
Yeah.
Those are two that we could maybe cover now.
As I said, with ST3, what is gonna be in ST1 to 7 is ST1 and 2 will be your basic training. Okay, so you're gonna be working under supervision of your registrar. You're gonna be working under your consultants, and they're gonna work towards these things which I said in the matrix. They're gonna work towards your basic skills, basic section level, in IUS insertions, surgical management, working towards basic gynae procedures and stuff like that. By year 3, you're gonna be a junior registrar. Okay, but again, you're not gonna working on your own. As I said, it's a senior support. Okay, so you're gonna work under a senior registrar and a consultant. Okay, they're gonna upgrade you, but they're gonna supervise you for stuff. But of course, they will be expecting you to do sections on your own. They're gonna be expecting you to do some surgical procedures on your own, like basic surgical gynae surgical procedures, like removing any coil, inserting any coil, surgical management of miscarriage, doing forceps delivery in terms of labor ward. They're gonna expect you to do that round on your own, make some plans. But again, they're gonna supervise you. They're gonna support you for that. Okay. But of course, you're done with your part 1. You're a bit up. Okay, but you're still under them. Okay. By year 5, you're gonna be the senior reg to some junior reg now. Okay. So when you're ST5, now your responsibilities are more towards your junior. Okay. Again, you will be expected to do all those things in your metrics on your own, and then ST6 and 7 will be under consultant. You will be most likely a consultant, but you're gonna still learn few things for that. Okay. And then again, they're gonna up you to the consultant level, but they're gonna supervise you for those 2 years, and then these are whole 7 years. Okay. The other question, which was like less than full time, of course, definitely they support that. Okay, it's not like if you're obs and gynae, they're gonna kill you for being in obs and gynae. My colleagues have gone less than full time. 2 of my colleagues after maternity leave, and they're very happy with that. Okay, again, that's gonna add some months to your training, but it's if that's what you are comfortable with, why not?
Yeah, again, really clear answers, and less than full-time training is a possibility in all training schemes now, isn't it? It's probably more easy to do this, I think, than it was maybe 10 years ago, 12 years ago. So certainly, yeah, ask for it, apply for it. There'll be many in your path who have done it recently, so speak to them and figure out what they did and what the process is. And it might differ from one dean to another, but certainly worth looking into it.
Yeah.
Yeah, it's a good brief run through from ST1 to ST7 and how it all scales up and what you're expected to do. So I mean, there are a couple coming in still now, actually, Shaista. So if you don't mind, we will just switch those across to you. So people, there's a few questions, so don't worry if you're not got an answer straight away, Dr. Shaista. We'll take the time to go through it. And yeah, please do check out the links that we just put up, the Facebook group, the follow on Instagram. There's a lot of good stuff, some good blogs that'll be very useful and answer a lot of these questions anyway. So please do tag those addresses and things for you to check out in the future. For sure, but yeah, thank you so much once again, Shaista. Pooja, I don't know if you take quick thanks yourself.
Thank you.
Yeah, absolutely, Shaista. Thank you for your time today.